Welcome back to Medicine Made Easy with me, Kavitendral. Now we will be discussing a very important topic in community medicine, that is from communicable disease. Before that, if you have not subscribed our channel, do subscribe for more interesting videos like this, and as well press the bell icon so that you will receive regular video updates. And you can share this video to your friends so that we all learn together. And there was one disease, one communicable disease, wherein the person affected has an adult nematode in the lymphatic vessel. The same person has the offspring of the same adult nematode in the peripheral blood. Yes, the person has the nematode and has its offspring. It means what? The person is a definitive host for that microbe, right? So next is because of this person is getting affected, Culex mosquito and Mansonia mosquito is going to transmit the infection to others. So it means what? It is a vector transmitting disease. Okay, because of this vector transmission, and this disease has become a public health disease, public health problem actually. So because of that, in the year 2020 set as target to interrupt the transmission. Now, how to know that transmission is interrupted? The current hypothesis, they say, is less than 1% of the prevalence of microfilariemia in humans is said to be an effective interruption in the transmission. Right. Okay. So how do we interrupt the transmission? By doing an MDA, that is mass drug administration. It is actually started in 2004. This mass drug administration of two drug regimens is started in 2007. What are the two drugs? It is ivermectin or diethyl carbamazepine with carbamazine citrate with albendazole. Okay, this is one drug, either of these, and this one drug. This is called two drug regimen. Did you guess what is the disease we are going to discuss about? Yes, it is lymphatic filariasis. Welcome to the discussion on lymphatic filariasis. This is part 1. Now we know the agent which is causing lymphatic filariasis is the microfilaria, especially Ucheriria bankrupti and Brigham milli. These two, Ucheriria bankrupti, Brigham milli, are seized microfilaria. There is also another agent called Brigham tumori, which is actually not seen in India. No, so that we are not considering about that. And the host is actually the intermediate host is the Culex fatigans, which is the older term. Now the newer term is Culex quinquefasciatus. This is the newer term or the name for this Culex fatigus mussel. And the intermediate host, that is a mosquito for Brigham milli and Brigham tumori, is Mansonia. There is also another vector, that is Anopheles mosquito for Brigham tumori, which we are not going to consider because that is not more common in India. Right. Now, the moment we remember this disease, that is lymphatic filariasis, we remember the night time because nocturnal periodicity is the marker of the disease. I mean, by 10 a.m. to 10 p.m. to 2 a.m. only, the microflora will be circulating in the blood. Okay, so when you think that by this midnight time, the microflaria is circulating in the blood, and the midnight time only the mosquito is going to bite, and that time the mosquito is going to take the circulating microflaria, and the next cycle starts in the mosquito. Right, so that is how this disease is transmitting night time. Now there is also a reversal in periodicity. That is, if the host sleeping patterns differ, no, at that time there will be changing or reversal in periodicity of this. Now, what happens is this female adult larva is basically a viviparous. This has nearly 15 years adult larva has 15 years of lifespan. Okay. Now, what happened? This microfilaria, after circulating in the blood of the infected person, now this has taken into the Culex mosquito after a blood meal. This mosquito has this microflaria. Microflaria, we said right that Ucheriria bankrupti and Brigham milli are sheathed microflaria. Okay, it has a sheath. So the first step in the mosquito is egg sheathing. It means this larva is going to come out of that sheath. That is all happening in the stomach, because blood meal goes to stomach of the mosquito. So in the stomach of mosquito there is egg sheathing. By egg sheathing, this larva is going to penetrate the stomach wall of the mosquito, and that time it is called a sausage shape. Sausage shape is very short and stout. That is stage 1 of larva. Stage 2 of larva is still inactive. Stage 3 of larva is called an active larva. It is called infective stage of larva, which is very, very motile. So this motile larva is now going to reach the proboscis of the mosquito. Now this mosquito is called as infective mosquito, and this infective stage of larva, which is present in the proboscis of mosquito, is ready to bite. The time when the process of egg sheathing to the appearance of the infected stage of mosquito is called as extrinsic incubation period, that is of almost of 10 to 14 days. Okay, this is the cycle in the mosquito. Now coming, is there any animal reservoir in India for this Sheetal microfilaria? Yes, for Brugia millai, it is there. That is monkey, dog, and cat. But for Bancroftian, that is Uchida Bancroftian filariasis, there is no animal reservoir which is seen in India. And they say nearly 1 microfilaria per 40 millimeter cubes of blood, human blood, the risk of infection transmission to the mosquito, which is taking the blood meal, right, that is nearly 2.6 percentage. Whereas if there is more than or equal to 80 microfilaria in 20 millimeters of cube of the blood, carrier blood, the mosquito is going to die because there are many microfilaria. All of these microfilaria, you know, right? All of these will exit, all of these will grow, and all of these for sure will cause damage to the mosquito, and mosquito dies in this case. Now we come to what are the host and environmental factors. Very simple. The host and environmental factor is all the age group are susceptible for the infection. Especially males are highly compared to females. Male are highly infected. Person who are migrating from the endemic area has a risk of giving the infection to the non-endemic area also. Right, that's the extension of infection. And we know Culex mosquito is the dirty mosquito because it is going to breed in all the dirty area. So bad drainage maintenance is one risk factor wherein the mosquito is going to breed. Rainy season is for sure making the mosquito to breed a lot. The most common breeding sites will be the cesspools, soakage pits, ill-maintained drainage, septic tank, open ditch, and burrow pits. All of these areas are most common breeding sites for this Culex mosquito. Now coming to incubation period. Incubation period, there are two things, two terms. One is pre-patent period and another is clinical incubation period. Pre-patent period means the inoculation of larva. That means the time when the microfilaria is entering, and not microfilaria actually, the infected larva, right? The third stage infected larva from the proboscis of the mosquito that is entering into the human body. That time to the maturation of larva that is reaching the peripheral blood smear as microfilaria. This time is called pre-patent period, but still there is no evidence that this is much of time is needed for pre-patent period. But we do have for clinical incubation period. What is the clinical incubation period? Clinical means that clinical signs has been seen in the patient. That is the time when the larva, the infected larva enters in the body to the clinical manifestation of filariasis. That is called as clinical incubation period, and this is 8 to 16 months. It is a long period. What other period we have studied related to incubation? Yeah, it is called extrinsic incubation period, which you studied now. The extrinsic incubation period happens in mosquitoes, wherein is the exciting of the microfilaria to the formation of third stage infected larva. That is called extrinsic incubation. That is 10 to 14 days. So with this, we are completing the introduction and epidemiology of lymphatic filariasis. We'll all meet in the next video. Till then, stay tuned. Bye bye.